I would like to welcome Dr. Prannoy from Kerala University of Health Sciences, India, to deliver this presentation titled The Rise of AI and the Implications in Orthopedics.
Good afternoon, ladies and gentlemen. I am Dr. Prannoy from Institute of Advanced Orthopedics, Kerala, India. So today I'll be discussing with you about the new technology that is developing, that is the artificial intelligence or AI, and how AI has influenced orthopedics and the implications that have in the field of orthopedics and the future prospects. So first, let's define AI. So AI is actually defined as the application of a complex algorithm to provide useful results without the need for human cognitive intelligence. In simpler terms, it is just a technology that replaces the human intellect using a computer. Now, it is already currently in use. If you look around, you always see that AI is already in use in most of our day-to-day activities. You see that in flight autopilot, in self-driving cars, in ChatGPT that we are commonly using these days, and also in robotics. Now, let's come to the implications of AI in medicine. So the background is that there is enormous amount of available medical data, and this medical data is ever expanding. For instance, there is around 5,000 new articles that are published daily in the medical literature, and it is virtually impossible for a human brain to comprehend this huge amount of data. But the advantage of AI is that AI can rapidly analyze huge amounts of data and make meaningful interpretations of this very huge database. Also, just like a human brain, with repeated exposure, AI can provide more accurate results. Just like a human being, when trained again and again, becomes more expert in a particular field, AI, when it is given repeated training, can become better and accurate in its results. Now let's come to orthopedics as such. So orthopedics has always been the leader of innovation. When it comes to technology, orthopedics has always been the leading field where the new technology is always adapted. For example, in robotic surgeries like robot-assisted knee replacements, and also 3D printed models like for surgeries and tumor processes individuals. Such as AI has always been an area of interest as soon as it was introduced into the world. Now let us try to understand a little bit about the different domains of AI and how AI works, so that how it can be used in our medical field. So the first and important part of artificial intelligence is machine learning. So machine learning simply refers to how artificial intelligence learns a new technology or a new skill or knowledge. And this can be learned and adapted over time. Now this comes in two variations, can be supervised or unsupervised. So in supervised, we need a human's observation or a human supervision over the AI to correct the mistakes that are made by the AI, and over time AI improves and makes less and less mistakes. An example of this is how to detect a fracture from an X-ray by using an AI. So how this works is how we train AI is first we load thousands and thousands of X-rays of normal bone to the AI. So AI first learns how a normal bone looks like. And then after that, we give thousands of X-rays of a fractured bone to the AI. So now AI understands how a normal bone looks like and how a fractured bone looks like. And this is repeated thousands of times before AI gets trained and how it can differentiate. So after that, after training is complete, when you give a new X-ray to the AI will be able to decide whether this bone is fractured or not. That is how machine learning as a supervised variation of machine learning works. Now there is another variant of machine learning called unsupervised machine learning. In this, what we do is AI is fed with thousands of images of unlabeled X-rays. So this will include, excuse me, for both normal as well as fractured X-rays. So now it is up to the AI to group behind two similar images that looks like a normal bone and those which looks like a fractured bone. So AI will ascertain by itself how a normal X-ray looks like, unlike the supervised version of machine learning. And now this process has to be repeated thousands and thousands of times before it can be used in clinical application. Now, a further more important or a further deep part of machine learning is deep learning and neural networks. Now, this is the next level of machine learning, where machine learning is added on by multiple layers to make more complex and different algorithms. So this is a more advanced version of machine learning where multiple complex layers of algorithm is used to form an artificial neural network. It is somewhat similar to the neural network that we have in our human brain. So for this deep learning network, we need human supervision right now, but it is currently in development that artificial neural networks can learn new things and new skills even without a human supervision. That is coming in the near future. Another important domain of artificial intelligence is natural language processing. So traditionally we had to use computer languages in order to communicate with the computer, like C++ or Java. But the advantage of AI is that AI can understand our normal human language, like English, for example. So we do not need any special coding to communicate with the AI. Now the application of this is that AI can scan our medical records that we use in our hospitals. AI can directly scan these medical records. They can scan and read operative notes. AI can look at the investigation results. It can look at radiographs and make intelligent inferences. There was a study in which AI was able to predict post-operative joint infection by reading the medical records, OT notes, and investigation results. So as the patient was being discharged, AI was able to say that this patient is going to have a post-operative joint infection, even before the surgeon was able to predict or diagnose it. Another important part is image recognition. So there was a study in which it was compared between AI and humans, and AI detected fractures from X-rays with an accuracy of 98%. And this performance was equal to or sometimes even better than humans, comparable to one of the most senior orthopedic surgeons looking at X-rays. In another study, AI was able to detect difficult to diagnose bone tumors or soft tissue tumors from X-rays, and detection rates were better than human specialists. It was also able to detect meniscal tears from MRI images better than human counterparts. And these findings that they gave from MRI were consistent with intraoperative findings when the surgeon finally went in for an arthroscopic surgery. In another study for revision arthroplasty, when the AI was given the X-ray of the implant used, within milliseconds AI was able to predict the type of implant used, the type of process used, and it suggested the extraction equipment that will be required for the future surgery. So it also detected implant loosening from X-rays better than their human counterparts. Another important part is predictive algorithm. Like AI can predict the duration of hospital stay as soon as the patient is being admitted, and mortality risk and other complications. For example, if you are doing a surgery and we are explaining the complications of the patient, for example, if there is a patient undergoing an arthroplasty surgery, we say that there is a risk of infection. AI will look at all the parameters of the patient, like investigation results, the past medical history and everything, and they say, oh, this particular patient is going to have a risk of 25% of having an infection. AI will be running in background and will be able to give very personalized and tailored results particular to the patient. So as soon as we are discussing the complications, AI will be particularly giving the tailored results to the patient. Another important thing that we have to understand about the current limitation of AI is that internal validation is effective. That is, once we develop an algorithm for a particular institution, all the other investigations will be validated for that particular institution. But if we use that algorithm to be used in another institution, that may have a different labeling system. The radiation dosage used for X-rays and CTs and labeling systems might be different from institution to institution. So one algorithm that is used for one institution may not be effective in another institution. So that is why validation is always necessary when you use a particular algorithm in a different institution. Another important application of AI is in surgical training. So AI can gather large amounts of data and give inferences. And there are currently applications like virtual operative assistant, where young surgeons can train using augmented reality or virtual reality and train their surgeries on virtual patients rather than on doing a cadaver or a live patient. So this helps and enhance patient safety as well as increased training of surgeons to deal with complications. For example, if you have to be trained in a complication like a periprosthetic fracture, we can simulate such situation using augmented reality, and the surgeon can train again and again over augmented reality on a virtual patient rather than a new patient. Another that is currently in use, an application is augmented reality in spine surgery. So in this, the surgeon wears a special augmented reality glasses, and when they look at that, the patient will have a 3D image of their CT or an MRI projected on the patient's body. Now this will help the surgeon in the approximate and accurate placement of metal hardware into the vertebrae and prevent neurovascular complications and other complications. So this will be enhanced in the future of surgery, that the surgeon will be able to look at the patient's MRI in real time on the body of the patient. It is also being used in rehabilitation, like in post-operative management. We can assess if the rehabilitation milestones are attained in a particular time that we set, and the AI will tell you that this patient's rehabilitation is not attained in this particular amount of time, and it will be able to suggest interventions early so that changes can be made to improve the range of movement. AI was also able to predict complications. Like in a study, they found out that AI was able to predict the risk of process dislocation after hemiarthroplasty. So AI, after seeing a surgery of a hip replacement, looking at the surgery, looking at the X-ray, AI will be able to say, oh, this patient has a risk of dislocation of this much percentage. And this was high accuracy. Whenever AI predicted that this patient is going to dislocate in the near future, most often it resulted in a dislocation. Now, being that said, there are a lot of limitations to AI currently. One of the most important disadvantages is the cost, because it's very expensive right now, but this is only a short-term problem, because in the future AI is going to be used widely and the cost is significantly going to come down, and AI is going to be a part and parcel of our life in our hospital practice. Another important complication can be data breach, like we gather all the confidential patient data, and because this is a computer, it can be hacked, or the patient data can be breached to the public. Also, it needs rigorous validation, and a simple error can result in a patient impact patient safety. So that is why it is currently under severe training and validation before it can be used solely for clinical use. Now, as a whole, AI has a huge potential to improve patient care. It can be used in diagnosis, can be used in personalized treatment, can predict the outcomes of a particular surgery or a treatment, can reduce the complications by providing adequate inputs, and also reduce the workload on healthcare workers. But also understand that the risks are still unknown, because AI is still in its development and we cannot rely completely on artificial intelligence for making any of the decisions. For instance, this is Mr. Geoffrey Hinton. He was known as the godfather of artificial intelligence. He was heading the AI unit in Google, but he resigned recently. And what he said was, human beings will soon be the second most intelligent species on Earth after AI. And AI, even though currently it is not conscious, it might develop consciousness in the near future. And when he was asked, how can we not predict what AI does? Because we created AI. And his reply was, AI was not entirely created by humans. Humans only designed the learning algorithm. So we only designed the algorithm that how data can be analyzed and how data can be used. But when this algorithm interacts with data, it forms neural networks and connections by itself that we still do not understand how. So it's actually how a mystery, that it's like the law of evolution, that we create the laws how it will learn, but what it will learn or how it will learn, we do not know how. Even now, we are not able to understand what it is thinking at the moment. So we do not know what AI will be thinking or what its intentions will be. That is why we always say there is a hidden risk in using AI. So currently, the take-home message is that at present, AI can be used only as an adjunct to decision making and not as a substitute. And doctors should be aware of the limitations of AI and make calculated judgments before using AI for any treatment. Thank you.
Thank you for your nice presentation. Any questions?
It's scary.
Yeah, yes, yes.
The one good thing as a surgeon is AI can't operate.
But it is actually in development that AI is operating even without human supervision. Recently, there was a study in which AI was looking at surgical videos. AI saw thousands and thousands of surgical videos, and AI was able to learn how surgeons do it, and AI was doing surgeries. It is not still used in clinical practice, but AI even learned things that we did not design to teach them. Like we designed how the surgical techniques, but when the needle falls down, we did not teach how to pick it up. But in a recent study, AI robot did pick up the needle when it was dropped. So it learned things even with that we didn't teach them to do.
One thing I would like to say, which AI can't replace is it can't make new innovations. Keeping the logistic aside and making things simpler for us in our day-to-day life. If we stopped, if we give everything to AI, who will think for the further innovations? Because AI just do work on the basis of the data given to it, and it gives everything to it, but not innovations or the data which has never been presented to it. So
yeah, we do not know currently the capabilities of AI yet because it's still in development. The thing is, even
actually, the thing of the AI is that it can't innovate. It can never innovate. It's going to link things of the facts in the past and the present, but it can't innovate. So we can't give everything to AI.
Yeah, definitely. We cannot give everything to the AI person.
Most likely, AI will never replace humans. Will never.
Probably. We do not know. Like what they said was the intentions are infinite. Like there was a recent incident where a school child was asking ChatGPT to do all his homework, and after like 2 weeks, AI scolded the child. Why are you asking me to do? Like we see that AI is developing some sort of consciousness. It's not just a machine, but it has some kind of individual thinking, something that is somewhat not till consciousness at present, but what even the godfather of AI says, it might be conscious on its own soon, and we may not know what it will think or what it will do if it is let out of control without human control.
Yeah, that's so future.
Yeah, let's hope for the best. Yeah.
Thank you. Thank you.
Thank you.
Moving on to the next presentation, I would like to welcome Dr. Vance